Hey guys, so my project is on nursing. I'm just going to cover kind of a general idea of what nurses do. There are tons of different specialties, so they all have their different duties and responsibilities. But the general duties include obtaining patients' vital signs, assessing patients' conditions, recording their findings. They also work alongside doctors to create patient care plans. They perform diagnostic tests and record the results of those and inform patients on how to manage their illness and injuries. So a lot of education for patients, which is something that doctors don't necessarily have the time for most of the time. Nursing requires about 2 years of education to start out with. Most employers do want to have a BSN at some point, which is a 4-year degree. Associate's degrees in nursing can be found at local community colleges like Blue Ridge. If a nurse wants to advance their career, the best way to do that would be to get more education, BSN, all the way up to a doctorate in nursing. So nurses with an ADN will find jobs, but BSNs are preferred and they will make more money that way. Some types of nursing require master's and doctoral degrees. That's mostly in the research and education fields. Once that education is completed, nurses can find jobs in a variety of environments. Nurses are used most widely in hospitals. 60% according to the BLS of nurses are employed in hospitals, so that's quite a bit. They're also used widely from hospitals to schools to camps, so quite a few different places. That's just a couple of them. Nurses are found on every floor of the hospital. They work directly under doctors and help patients and administer treatments. This is also from the BLS. Shifts in hospitals are usually 12 hours, but they can consist of on-call shifts where they can be called in anytime in a certain time frame to work. Nurses can also be found in schools, camps, and clinics. Shifts can vary on employers' needs or businesses, but sometimes if you're working on a clinic, that can be a 9 to 5, or it can be up to a 24-hour on-call if you're working at like a camp or something where you stay there. Sometimes the pay is a little bit less than hospitals due to less demand and a different responsibility. With the various work environments for nurses also comes with a very varied job description. There is quite a number of different specialties for nurses, so many that we can't really cover all of them, but you won't ever get bored or run out of options for different jobs. There are several main categories of nursing, the most common being floor nurses in hospitals, and they are on all levels of the hospital. A couple of examples of them would be emergency nurses in the ER, critical care nurses in the ICU, cardiac care nurses, and this was found on nursing.jnj.com, Johnson & Johnson. There's also some other options that are more specialized and require more experience. CRNAs and nurse practitioners are the most popular routes for advanced nursing. They require a master's or doctoral degrees for CRNA. These definitely do pay quite a bit more. This was also off of the nursing.jnj.com. There's also some other specialties like flight nurses, lactation consultants, holistic nurses, and they're more specialized and require extra certifications, but not advanced degrees. So yeah, those are the main points of my speech here. Thank you.